Alzheimer disease. In this PowerPoint, basically, we should talk about the Alzheimer, means what it is, and also the type of Alzheimer. We should figure out what are the defense mechanism used by the patient and what are the key medication used to treat the Alzheimer. And also, here we go to talk about the nursing care of the Alzheimer patient and home safety, including in this PowerPoint. So in this picture, the compare and contrast healthy brain and Alzheimer brain, right? So as I told you, the Alzheimer disease are the non-reversible neurocognitive disorder, like dementia, and resulting in the memory loss, problem with judgment, and also change in personalities. So healthy brain, you can see the brain matter is a full and the ventricle are very narrow or small. This is called cerebral cortex, and the cerebral cortex is responsible for language and also information processing. And this area is called hippocampus. They are important for critical thinking or critical to the formation of new memories. If you compare and contrast the person who have Alzheimer disease, their brain, you see the cortex area is damaged, involving. So when the damage this cortex area, definitely patient thinking process will be impaired. Thinking process, planning process, language center, and also the ventricle is bigger than the healthy brain. Ventricle filled with the cerebrospinal fluid. This is the ventricle, bigger. And hippocampus, what are the responsible for critical to information of the new memories? This hippocampus shrinking severely, right? And here we go. Next here, as I told you, Alzheimer is a neurocognitive disorder. Alzheimer is a mental health disorder and also neurocognitive. And it is non-reversible and resulting the memory loss, and patient present with some problem like impairment the judgment or change in personality, and most prominent dementia, right? So dementia basically a symptom with progressive deterioration in intellectual functioning or secondary to structural or functional change, right? So long or short-term memory loss occur with impairment in judgment abstract thinking, critical thinking, problem solving ability reduce, and also behavior problem. Dementia result in a self-care deficit. They forget where they left their belongings, keys, glasses, hearing aid. Dementia-like symptom can be result of physiological condition, and such condition must be rolled out, right? The most common type of dementia is Alzheimer. So any other medical condition, dementia is also common, like Parkinson disease or senile type of dementia. Basically, dementia means forgetfulness, right? So now we have to talk the so I mean Alzheimer disease is an irreversible, right? Irreversible from a senile dementia from nerve cell deterioration. Definitely, Alzheimer is non-reversible or irreversible. Individuals with Alzheimer disease experience cognitive deterioration. So neurocognitive disorder basically, and the progressive loss of ability to carry out activities of daily livings. The client experiences safety decline in physical or mental functioning and usually require the long-term care facility and placement in the final stage of illness. If we give a focus on the stage of Alzheimer disease, we can see there are 4 stages. Stage 1, basically mild form, most common, forgetfulness. So memory lapse or frequently misplacing the item or difficult of concentrating. And in the stage 1 or mild Alzheimer, no issue about their daily living activities. What about the stage 2? What is called moderate? The patient are confused in these states. So in this stage, difficult of planning or organization, right? And personality and behavioral change take place in the stage 2 or moderate level. The stage 3, moderate to severe, patient problem with ambulatory dementia. So patient need assistance needed with daily living activities, and patient incontinence, loss of ability to move, right? And the stage 4, the late stage or end stage. Basically, dementia patient or Alzheimer patient is die usually due to infection or choking. So it is very important to how to take care of the patient who have dementia. So nursing intervention is important, and also home safety. Home safety is important here. So Basically, we are going to intervention one by one. So identify and reinforce the retained skill, provide continuity of care, orient the patient about the time, about the date, place, right? And also furnished the environment with familiar possessions, acknowledge the client feelings, help the client and family members memory deficit and behavioral change, encourage the family members to express the feelings about the caregiving, provide the caregiver support and identify the reason and support group availabilities, monitor the activities of daily living. So always keep in mind the safety is most important for the patient, right? We always try to provide the safety environment and protect the patient from fall or wandering. So remind the client how to perform their self-care or daily living activities. Help the client to maintain independence. Always we has to encourage them to be depends on themselves. Also, it has to correct to the family to participate in the patient care. Provide the client with a consistent routine. Provide exercise such as yoga, walking. Avoid activity that tax the memory. Allow the client plenty of time to respond or complete a task. Use the constant encouragement, right? Courage in simple step-by-step approach. Provide the activity that distract and occupancy time, such as listening the music, coloring, group working, watching TV. Provide the client with a mental stimulation with simple games and activities. So also it is very important use the monitor or bed alarm is needed and place the patient in a room near the patient station. Provide the prominent display calendar or clock, right? It's very important. Maintain the consistency with caregiver. Maintain consistency, right? Use the clean voice, short sentence, and limit the choice. What else? About the wandering, provide a safety environment, right? First priority, prevent, protect from fall, provide unsafe wandering, provide close supervision, close and secure the door, means home safety. Use identification bracelet and electronic surveillance. So home safety is super important for Alzheimer patient, right? Always we has to remove all scattered rag. We has to install the door lock, secure the door, or lock away cleaning supply, provide a good lighting in the room, and also mark the step is with a color tab. Also install the handrail in the bathroom and place the mattress on the floor, right? And remove any kind of gutter. It's very important home safety. One of the syndrome is called sundown syndrome. What it is? What is sundown syndrome? Sundown syndrome means is characterized by a pronounced increase the symptom and problem at evening. So when sundown problem is increased, it's called sundown syndrome. Provide a safety environment. As I told you, first priorities, right? Safety environment means protect from the fall, to remove the scattered rug, close the door, use bright light or good lighting, mark the steps as with a color tape. Communication, another most important for the patient, right? When you communicate with the patient, better to use the simple word or sentence. Provide include the language disorder, right? Also adapt the communication level of the client. Use a firm volume and low pitch volume to communicate. So do not need to talk loudly, right? As normal. Use a firm volumes. Call the client by the name. Identify self. Wait for a response. So when you ask something, be silent and allow them to verbalize their feelings. And they has to organization. So better to wait and use a claim or reassurance voice, right? And speak slowly and clearly using short word, single word, simple sentence. Ask only one question at a time and give one direction at a time. Repeat the question if necessary, right? So it is very important we have to know how to take care or what is our responsibilities with Alzheimer patient. Now here talking about the dementia and Alzheimer, impaired the judgment. This is the most common problem of the patient. Altered thought process. So we have to call the client by the name. Orient the client frequently means ask their name, ask what date today, where you are, is it home or is it hospital or it is a hotel. Orient them. Use the familiar object in the room. Just say what it is. Place the calendar or clock in a visible place. Maintain the familiar routine. I mean, same time, go for exercise, go for eat, go for take bath, same time, routine. Take the task sample, allowing time to the client to complete their tasks. And also is positive reinforcement for positive behavior. What next? So altered sleep pattern. So they have another problem of altered sleep pattern. Also hesitation. This is important to point here. So altered sleep pattern allow the client to wander in a safe place, prevent shadow in the room by using indirect light, avoid the use of hypnotics because they cause confusion and aggravate the sundown effect, right? Sometimes it is important to know about the defense mechanism. So sometimes patient has denied, they refuse to believe the change or memory loss. Take time to adjust, or confabulation means the patient make up story to prevent the admitting that he or she does not remember the things. And also it is important, it's called participation. Patient is repeat the phrase to avoid answering the question. Hesitation means assess the precipitation of agitation, reassures the client, remove the item that can be hazard, or approach the client slowly and calmly from the front, and then speak, gesture, and move slowly. Remove the client to a less stressful environment and use touch very gently, right? And do not argue with your patient. And for the dementia, there's some medication can work, like the medication is called doneprazil. Doneprazil. So doneprazil is a cholinesterase inhibitor and slow the cognitive deterioration and improve the ability to perform daily living activities. But keep in mind the doneprazil have a side effect. The side effect include GI upset or bradycardia. It is very important, you have to know the doneprazil we should admin once daily at the bedtime.